in.
Hello.
Hi.
My name's Caitlin. I'm going to be the nurse practitioner conducting your cardiovascular assessment today.
Okay.
Can you please confirm your name and date of birth for me?
Yep, Nolan, Enos, 91098.
Good. And do I have consent to perform this exam today?
Yes, you do.
Good. So I've already performed my hand hygiene. So what I'm going to be doing first, Nolan, is I'm going to be inspecting your precordium, your carotids. Then I'm going to move over to palpating. I'm going to palpate your precordium, your carotids, bilateral lower extremities, your pulses. Then I'm going to move over to auscultating, and at the end we'll do some special testing, okay?
Okay.
So first I am inspecting his precordium. I'm looking for any heaves, lifts, any visible pulsations, which I don't see. I am looking for scars, deformities. I see freckles. I see that he has chest hair on his precordium. I am also going to be looking at his apical impulse location, and I don't see any concave chest going on, so that's a good sign. And I'm going to be inspecting your peripheral extremities. I don't see any cyanosis, and I don't see any edema. So then I'm going to be looking at your jugular venous pressure. And what I'm going to do is I'm going to take out my ruler, and I want Nolan to turn his head to the left for me. I'm going to identify where I see that pulsation, which is right about here. I'm going to put a straight edge up to this pulse. Any pain with this?
No.
And I'm going to take my ruler and measure. And I see about 1.4 centimeters, which is good. So now that we've done that, I'm going to start palpating. So I'm going to palpate your precordium. I'm also looking and feeling for any thrills, abnormal pulsations over your valvular areas, any heaves. I'm going to move on to palpating your apical impulse. And seems like a good size. The location is correct. Not feeling any heaves as well. So next we're going to move on to palpating your pulses. So I'm going to feel your carotid pulse, and I'm going to have you stay just like this. I'm going to measure and grade them. Good. Carotid pulse is strong, non-bounding, 2+. We're going to move on to this side. I'm going to assess his left side. Good. Carotid pulse is 2+. Or I'm going to have you put your arms like this for me. I'm going to assess his brachial on his left side. Good. Also 2+, nice and strong. His radial on his left side, non-bounding and strong, 2+. We're going to finish it off on the upper side with your brachial on your right side, non-bounding, strong, 2+. Your radial, also non-bounding, strong, and 2+. So his pulses bilaterally are equal. We're going to move on to palpating his femoral. Good, and that is nice and strong, 2+. We're going to move on onto the left side. I'm going to palpate his femoral pulse. Good, non-bounding, and strong, 2+. We're going to move on to your lower extremity pulses. I'm going to be measuring your popliteal. I'm cupping my hands underneath Nolan's knee. Good, nice and strong. That is also 2+. As I'm doing this, I'm comparing the pulses bilaterally to see if they are equal, which they are so far. Popliteal on the right side is also 2+. We're going to measure the posterior tibial pulse on his right side. Strong, non-bounding, 2+. On his left side, strong, non-bounding, also 2+. Measuring his dorsalis pedis pulse on the right side, on the left side. Strong, non-bounding, 2+. And then finally, his right side also strong, non-bounding, and 2+. So then I'm going to be looking for his capillary refill, and what I'm going to do is I'm going to pinch his nails, looking for that color to come back. That looks good. Good. Capillary refill is less than 2 seconds bilaterally. I'm going to do it on his upper extremities as well. Can you please rest your hands on the top of your thighs? Good. Right capillary refill, less than and equal to 2 seconds. So now we're going to move on to auscultating. What I'm going to do first is I'm going to assess for any carotid bruits. So I'm going to use the bell of my stethoscope. Can you turn your head to the left for me? Good. I don't hear any abnormal findings. I don't hear any abnormal turbulence. Can you turn your head to the right? Very good, Nolan. So then I'm going to move on to auscultating his precordium. I am going to be listening to S1, S2, looking for S3 or S4 sounds. I'm going to be listening to all of his valves, and I'm going to be listening with the bell and the diaphragm. So first we're going to start with the diaphragm, and then we'll move on to using the bell. So I'm starting at his clavicle, I'm moving down to his second intercostal space, and I'm listening to his aortic valve. This is also his S1 sound. Good. Then I'm moving on to the left side of him at the second intercostal space. Good, I hear his pulmonic valve, and I also hear S2. I don't hear any S3 or S4 sounds, gallops, clicks, murmurs. So then I'm going to move on to palpating Erb's point, which is at his third intercostal space. And I hear the lub dub. I'm going to go to the fourth intercostal space so I can hear his tricuspid valve. Good, I hear the opening and closing. We're going to move on to his fifth intercostal space. I'm trying to hear the mitral valve, and I do hear it, and that is at the midclavicular line. Very good. So now that we've completed the auscultation portion of the exam, I'm going to be verbalizing and conducting some special tests during cardiovascular assessment. So with orthostatic blood pressures, you want the patient to lie just the way Nolan's laying in a supine position, take their blood pressure and their heart rate. Then you're going to have them sitting, and you're going to measure their blood pressure and heart rate, and then you're going to finally have them standing. And what you're looking for is a 20 millimeter of mercury decrease in their blood pressure, and that will confirm a positive orthostatic sign. Next, I can perform the Allen's test, and what I'm going to have Nolan do is I'm going to have him extend his arm. I am going to have him make a fist. I'm going to occlude the radial and ulnar arteries, and then I'm going to have him open his hand and not occlude the radial and ulnar arteries, and see the blood flow and the color come back. So I'm going to do this on the right and the left side. We're going to start off with the right. So I'm occluding the radial and ulnar arteries. Okay, and open your hand. Now I'm going to not occlude it, and I can see his color flushing, and his hand is pink, warm, and dry. We're going to do that on the left side as well. I'm going to occlude the radial and ulnar arteries. Open your hand. His hand's nice and white. I have stopped occluding it, and now his hand is turning pink and it's flushed. Very good. So the ankle brachial index is what somebody measures for peripheral artery disease if it's suspected, and I didn't suspect that with Nolan, so that test is not needed. The Homan sign is needed for DVT, or if it's suspected. I will perform it. However, I don't suspect that Nolan has a DVT, but for purposes of this exam. So what I am going to do is I'm going to put my hand underneath Nolan's calf. You can have your Yep. I'm gonna have his leg nice and rested, and I'm gonna dorsiflex his foot. Nolan, do you feel any pain with that?
No.
So if somebody feels pain with that, that may be a suspicion of DVT. It is not a diagnostic test, but it will help a provider or the nurse practitioner get some kind of idea of what's going on if it's suspected. So I'm going to perform it on the left side. I'm going to dorsiflex your foot. You feel any pain?
No.
Very good. So Holman's sign is negative. As I was performing this exam, I was also simultaneously looking for edema, and I don't see any dependent edema. I don't see pitting edema. I'm going to palpate just to make sure. I don't see any of that either. In his bilateral lower extremities, and as I was assessing his bilateral upper extremities, I didn't see that either. Simultaneously, I was also observing for any skin changes, any venous stasis, any ulcers, any wounds, anything that would pertain to the cardiovascular assessment or give the practitioner an idea that there is obstructed venous or arterial flow, which Nolan has not exhibited any of that. So that concludes the exam. Thank you for being my patient, Nolan.
Thank you.